and this is Erica Mizuta, owner, CEO, and doctor of physical therapy for Recover. So today we're going to talk about back pain, but before we get started, make sure to hit the like and subscribe button at the bottom. So Erica, can you give us some stats on back pain?
Yeah, so I'll give you some recent stats that were done by Georgetown University, and they found that 65 million Americans at any given time have back pain. 8% of adults have chronic back pain, and 1 in 4 people that have back pain are in poor physical health. Also, 83 million days of work per year are lost because of back pain. So pretty much almost everybody in their lifetime at some point is going to experience some sort of back pain. So that's pretty significant.
Yes, indeed. Now, do patients ever go to physical therapy before seeing their primary care doctor about back pain?
So the answer to that question is it depends. And mainly it depends on the injury and how the person's injured. So if somebody is injured at work, then they're definitely going to be sent to a doctor first, work comp doctor, to be evaluated. Most people, though, are the people that wake up and they have the neck or back pain. They're not going to go to the doctor usually in the beginning. A lot of times they will either call their physical therapist, because we have direct access in California and they can do that. They may wait, which we don't like to see because then it gets worse. Sometimes they will go to the doctor, and if they go to the doctor first, what's going to happen is that they're going to be usually given a pain med and a prescription of physical therapy, which a lot of my patients never take the meds anyway. They just want the therapy. So just remember, in California, you can always use direct access and go directly to your therapist. It speeds up the process.
Very good. Can you elaborate on the difference between cervical, thoracic, and lumbar back pain?
So your spine has 3 different regions. So cervical is going to be right behind your neck. Thoracic is more in that mid back, and then lumbar is low back. Now, people can have pain in all 3 regions. They can have pain in just one region. It kind of just depends on what has happened to them. The other thing that we see commonly in physical therapy, which a lot of people don't realize, is that if you have a nerve problem, a pinched nerve in your neck or in your low back, you may not even have neck or back pain. It may be numbness and tingling in your arm or hand, or it could be down your leg. So I see a lot of people that come in and think they have an elbow problem. They don't have an elbow problem. It's actually coming from their neck. So that's one of the things that we'll figure out in therapy.
Okay. I once had some physical therapy for my neck because I had numbness in these fingers, and I did not realize that it was a neck issue.
Yeah, and so that's the thing, is that when you go to a qualified therapist that really knows their anatomy, if you notice that she moved these 2 fingers, I can tell you that that is from C6, C7 area in her spine. So you know exactly where it's coming from. It's going to be coming from the neck, unless it's coming from our older nerves. So those are the things that we'll look at in therapy and figure out so that we can have a good treatment plan for the patient.
So what does treatment for back pain look like?
So you should get a full, thorough evaluation just to make sure that it's not coming from any other area. So once the physical therapist knows exactly where your pain is coming from, if it's coming from a nerve, if it's coming from a disc, muscular, postural, then they can develop a treatment program for you. So that treatment program is usually going to be exercises. It's going to be postural exercises to get you in a good position so that you don't make the pain worse. So it's really going to focus on pain relief and also returning you back to your function so that you can get back to your life.
Okay, very good. So this was great information today. Stay tuned for more videos from Recover.